one of the very interesting thing about CAR T-cell therapy, besides the very high response rate, which we keep on mentioning because we are so fascinated with it, we haven't seen responses like this with any other treatment. So in the 5th and 6th line, having 90% plus responses are unbelievable.
And that's the guru of MRD.
Yeah, so
the MRD establishment is even amazing. Right?
That was going to be my point, that it not only we get response, but we get really deep response. Close to 50%, a little bit over 50% patients get MRD negativity,
Right.
and it's achieved very quickly. So any thoughts on that? What do you feel about that? I know we're all thrilled about it, but just to see what you think.
So I'm very excited, that just as you are, about the fact that we can get bone marrow MRD negativity very quickly. I do remain worried a little bit that T cells may work better in the bone marrow, and some of these relapses that we may see in the future might be extramedullary and in other sites, and that may need more imaging follow-up and more close follow-up to small sites of PET activity, etc. So I'm actually very thrilled about the MRD negativity rate in these studies, but cautiously optimistic, I would say.
Yeah, I think we both are on the same page about MRD. It is our ultimate goal, and we're all actually in last couple of years trying to make MRD as the surrogate for response. It's going to be benefiting everybody if we get that. From the point of view of patient care, that's where we need to go.
Exactly.
From the point of view of deciding treatment to some extent, and also from the point of view of doing studies that we can get endpoints much quicker.
Endpoint. And ultimately, if we're ever going to cure myeloma, those patients who are going to get cured are the patients to get MRD negative.
But the CAR T patients still do relapse, and even when they are MRD negative, right? So I think similar to your allogeneic experience, which you have tremendous amount of, that is where also patients do relapse from extramedullary disease. So we have to, I think, keep that in mind, that patients would have extramedullary disease, and that when we follow this patient, we need to do appropriate investigation with PET, CT, and other to look for those. So MRD is great, but in this particular late-stage patients, looking for that.
It does not carry the same weight as the upfront that you have showed in the past, right?